Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome back to the Low Carb MD podcast. Tro, we have a good one. This is a really important topic. A couple people might be interested in.
Oh yeah, I mean, I think this is the most common thing that we get approached with. We have two, awesome health coaches, and if you're not following them, you should right now. They make up the dynamic duo at Wise and Well. Actually, maybe we'd be, the second best dynamic duo out there, I think. Right? The second best.
Take that.
So we have Maria Claps and Kristin Johnson. Just a little bit about both of them. Both of them are health coaches. Kristin is, a recovering attorney, we were just talking about this. She's board certified in holistic nutrition. She's certified Dutch hormone test provider, and she's gone through the program of functional nutrition therapy. And Maria is also a health coach with her education from the Institute for Integrative Nutrition, also completing a program in functional diagnostic nutrition. And I'm just going to start off before we go any further, like how, and I just said this a moment ago, but I want to say it on air. The way we started interacting was a referral. I got a referral a number of years ago from a patient who needed help with some weight loss, but also wanted help with some overall sort of wellness and health. And they said, well, my health coach said, I must see you. And I said, okay, that's great. I was like, well, who is this health coach? And can we talk to them? And then the patient went off to explain what the health coach was thinking about, what the reason for the referral was. And it was about really advanced medical topics that, most doctors don't even know. We were talking with that patient. My health coach suggested, not as a medical suggestion, but talked to me about calcium scores and their utility and sort of, what the scientific literature says about it, talking about hormones and talking about sort of the ways to diet, the different ways to diet, the perils of dieting, relationship to food, all of these topics that most doctors don't even know. And I got out of that visit with this patient and I was like, this patient has so much education empowerment. I was like, I want to know who this health coach is. And I picked up the phone and I called you. I think it was Kristin, right?
Yeah.
And
it was a mutual patient of mine. We do everything together, but you ended up calling me. Yeah.
Yeah. And I said, I was like, I have to figure out who this is. And I think we've had a number of patients together now, and they've all done miraculously. And I have to say, you guys are doing amazing work. I know each of these patients, I know what they have, the kind of the guidance you guys have given them has been invaluable. And besides the fact of these 5 people that I may know about, or 10 people, however many it is right now, your following on social media is just huge. Instagram, if you're not following them, I think it's like 50 or 100,000 people now following you guys.
Not up to 50. We'd love to have 100, but yeah.
Yeah. So welcome. And Brian, sorry, I'm going to shut my mouth now. Brian's already falling asleep. So.
I'm old. Yeah, it's my nap time, Tro. No, I'm so excited. Let's get this rolling.
So guys, how did you guys meet? And maybe you guys could talk about that. And then, maybe both of you can talk about your individual focuses and how you guys work together.
Yeah. It's kind of funny because you, in our bios, gave me credit for being a Dutch expert. And I will say I'm actually one of those because of Maria. So that is really how we met, in that we were both practicing individually. I was more kind of in specific general nutrition, working a lot of grassroots work in my community and whatnot, and just started to notice I had a lot of women who were coming in as clients, all in a similar demographic, age group, et cetera, struggling with these things. And it was clear to me that there was an endocrinology aspect of this, just time of life and hormones and changes and their symptoms and whatnot. And so I started trying to dig deeper. I said, I want to get more into this specific area. And in order to do so, I would like some testing, qualifications. And so I started looking at education programs to learn more about specific women's testing. And that's how I stumbled on Maria, because she actually had an entire course teaching other practitioners on this modality. So I ended up enrolling in the course, and I knew from the get-go that we were going to be future wedded to each other, because the day I just sent a blind email inquiry, I get this message back saying, call me, and her phone number. And I'm like, who is this person? And so I called her, and we, I thought I'd have like 5 minutes of her time to ask questions. I think, Maria, we talked for over a half an hour, and we just connected on a lot of different levels, as women, as moms, as, spiritual levels, everything. And I ended up taking the course. And at one point we just kind of knew that we wanted to work together, and thank God we have each other. I'm sure you and Brian feel the same. I mean, this is really energetically demanding work and a high burnout rate. And so for the two of us to have each other, it benefits the client, to be perfectly frank. They're always getting two sets of eyes. But it just makes us kind of really continue to keep our cups full and have the energy to keep going. So
actually, Brian regrets the day he met me. I know he tells his wife.
No, I'm pleasantly surprised. It was taking a chance on this guy. He might have said a few people here and there, but overall it's been a great thing. But Troy, it's been great working with you, learning from you, and comparing notes. We may have different personality types and different styles on social media, but we all balance each other, and that's so important, because one of us has an expertise in one area, another one's focused on another, and then we could benefit the patients that much more. And that's why it's so great having two of you doing that. And for me as a practitioner, having a great health coach makes all the difference in the world, because the patient needs you, and that's an ongoing relationship that's so important.
Yeah. I always joke that Maria is my work wife, and to that end, there's all these little unique things about her that are literally mapped over exactly to my husband of 30 years. And every time it comes up, it could be as little as like loving her coffee, or certain herbs in her food that I despise, but my husband loves. And every time it comes up out of her, I'm like, of course, because I'm married to you in work as well as life. So
I'm the female version of your husband. Yeah.
So how did you two get into what you're doing? Like, what was your path? I mean, being an attorney and then going into a totally different area. How did that, for both of you, how did you transition into this? And what was what did you want to do?
Yeah, so I loved practicing corporate law. I was a securities attorney. I had 3 kids. I balanced it all for a long time. 80-hour work weeks and being a mom don't exactly have great synergy. So eventually, we were financially at a place where I just looked at my husband and said, I feel like I'm 100% of nothing. And I want to do well at what's most important to me. So I did take a long time off to be with my kids. And then, as I think for many of us, a personal health situation drives you to become curious because of frustration with the conventional system. And for me, it was one of my kids he had encephalitis from mosquito bite, to be perfectly frank, and watching his recovery, learning about the importance of fat for the brain and ketogenic energy and whatnot. And then my dad unfortunately got sick with cancer, and watching how unbelievably underserved he was, in fact, negatively served within the system. Watching a very robust man suddenly not be able to remember words, and figuring out that it was a B12 deficiency, and that maybe he shouldn't be in the hospital, just be giving a sugar drip and whatnot. So that drove me to get more curious, to ultimately end up in nutrition school. And then I had some of my own issues too. And, once you learn a little bit, you get dangerous, because now everyone that you love becomes your client. And so
whether they want to or not.
Exactly. And we learn, right? We all learn the hard way that, like, you can lead a horse to water, and so, ultimately then, being an attorney, my attitude was, I need credentials in order to do this. I can't just be some, neighborhood mouthpiece or friend of girls that wants to go out and tell them how to eat and change their lives. So that's how I ended up in school. And then, like I said, started my own practice and discovered Maria. But, for getting into this space too, it was client driven, but it was also myself. I mean, I was in my mid 40s and had a lot of things going sideways. And I was in Boston. I was in the heart of big pharma and, conventional medicine. And I had a lovely functional doctor who essentially told me there's nothing wrong with you, completely gaslit me, refused to do testing on me as a woman. And I'm like, something's wrong. My mom went through menopause at 32. I feel like something's wrong. You're fine. Nothing's wrong, et cetera, et cetera. So I got completely shut out of the system. And that was where I said, no, something else is happening here. I'm a very healthy, active individual. That's how I pivoted into hormones. And Maria has almost the opposite end of the spectrum.
Yeah, it's basically personal need that kind of drove that inquiry and that deeper learning. I was probably about 43 or so when I noticed that I just didn't feel well. So I did seek out a doctor in New York City, kind of claimed to be holistic and integrative. And I thought I had done my due diligence, but it just turned out that I didn't receive terrible care. I just don't think I received optimal care. I was given HRT, which we're perfectly fine with. I feel like I was probably just a little bit too young to get started on that. You know, massive doses of vitamin D, a ton of supplements, no education on diet, no education on like how my body was changing, what was going on hormonally. And I just kind of at that point I was like, oh no. And by the way, Klonopin, because I wasn't sleeping well. So like, in other words, all the holistic stuff, but we'll just throw this stuff in. Ended up getting addicted to that. I did actually wean myself off of it. And I was like, no, there just has to be a better way. And so that's when I sought schooling and even more importantly, mentorship.
Yeah.
From physicians who had been practicing for, a decade or more.
Yeah. And we continue that to this day. I mean, both Maria and I continue literally paying physicians for mentorship.
Yeah.
Yeah.
Mm-hmm.
So it sounds like you guys each had your own sort of frustrations with the modern sort of medical environments, doctors who maybe didn't serve you well, and or health. You saw health deteriorate either in yourself or others, and then you turned to people for help, and it sounds like you just didn't find the help you needed. Can you do you guys just mind going into that a little bit more?
I mean, for me, I did question whether or not I had an issue with gluten. And it wasn't because of being on trend or needing to lose weight. I was noticing, in fact, to the extent that one of my wedding rings, I had to get resized because I could not get it up over my knuckle. And my mom did have rheumatic fever as a child. And there was concern that through the birth canal, I may have, developed. And so I said, could you at least test me for RA? Like I'm in my late 30s, early 40s, and I literally feel like an 80-year-old woman. Something is wrong. My joints hurt. No, refuse to test me. So at a certain point, I did discover, the Whole30 and paleo eating and things like that. And just diving into research behind it and thought, could this be triggering inflammation that's causing my joints to be such a problem? And you have to understand, I've had more surgeries. Maria, we counted them at one point. I think we were at 13, 14 surgeries that I've had on joint reconstruction and various things. And all along, I'm being told food has nothing to do with it, right? There's no way food is driving any of these problems. And to get anyone to consider nutrition as a lever in my health was absolutely impossible. So there was that. There was also, I was a competitive rower. I was living outside of Boston. I competed at the national level and the world level and, very, very highly competitive rower. It doesn't do, a lot on your body. There's a lot of damage after a while. The concept of over-exercising never even came into the conversation. And they all knew what I was doing because I was being followed by sports medicine docs and cardiologists and whatnot. So there were those sorts of things where my health was literally in decline. And then there's the personal stuff as women, your intimacy changes, et cetera. And that's where I'm going to the doctor saying, could it be my hormones? Nope. At 43, you are way too young for it to be hormones. By the way, here's a Mirena or a birth control pill. Take it till you're 55 and shut up. So it was those specific things, where I was like, full stop. And I wasn't sleeping at all. Did anyone ask me if I wasn't sleeping? Never. Right. So, talking about nutrition, sleep, movement, it's all the basic lifestyle foundations. And I had to fight for that and still was gaslit. In fact, I'll share a quick anecdote. Before I left, we just moved outside of Chicago. And before I left Boston, I informed my holistic MD of what things that I was leaning on in order to improve my health. And she looked me dead in the eye and said, if you continue that, you're going to die an early death. And I will not continue to have you as my patient. So I got fired
because at this point you were using hormone replacement.
Yeah, I was considering. Yep. Mhm.
Holy like, can we, I want to talk, I want to talk about this, but I want to hear from Maria as well, but I cannot say, and it's interesting how much reversal has been there in that space, in the sort of the lifestyle space, talking about the effects of sleep, the impacts of aging on metabolism, on the impacts of menopause, peri-menopause on body composition, the impact, like in my mind, hormone replacement therapy has been exonerated, whereas, and I think it has been, even if you go back into the early data, it was there, so I want to talk about all of this, but I also want to hear from Maria. So can you talk to us about how did medicine let you down? Because it sounds like it's let you down.
Yeah, so I think I was about 43, and I really was not sleeping well, and my mood pretty much sucked, if I'm being honest, and I was kind of bitchy to my family and my kids, and I just knew something was changing. I didn't know what it was, but I knew something was way, way off. So doctor was Park Avenue, New York City. I think I visited him the day after Christmas. Okay, so anyone in Manhattan. So anyone the day after Christmas in Manhattan, it's really crowded, hard to get a cab, all that stuff. That's how desperate I was. Interestingly, literally one of the first things, again, holistic medical center, huge staff, walk up to the desk. One of the first things is, do you want a flu shot? I'm like, no, I'm like, not here for that. Like, what are you trying to sell me a flu shot for? I thought that it was a red flag at that point.
At 43, nonetheless, right?
Yeah. So yeah. Oh, and just like, I'm here for evaluation, help, coaching, whatever. Kind of thought, maybe it's hormones. Anyway, a lot of tests, like thousands and thousands of dollars out of pocket too. And then again, it was a 50,000 IU vitamin D. It was HRT, but which I don't know. I don't think I was ready for it at that point. Maybe I was going to be ready shortly after that. No explanation. And I will say, Kristin and I, one of the things we feel is critical to HRT success is what it is, what it does, what you want to achieve with it, what are possible side effects, how to deal with those, what are the benefits, nothing like that. If I hadn't, we really believe in the power of education. Had I known, maybe I would have had a better experience with it. A ton of supplements. Again, not necessarily against these things, but my biggest issue was just learning through a fire hose, like health through a fire hose, zero support, zero coaching, zero explanations, and just kind of sent me on my way.
So what it sounds like in both cases is you had these medically unexplained symptoms, right? And when I say medically, they're explainable, and I know both of you guys have the education to explain it, but they were uninterested in these symptoms they couldn't explain, right? That's basically what it comes down to, right? They were uninterested in these symptoms they couldn't explain, and what they did was they threw just standard nonsense at you.
Yeah.
Like, here you are, here's birth control. By the way, new study, large meta-analysis of birth control data showing that it impacts mood negatively, especially when taken at a young age, not when you're lacking the hormones, when your body makes the hormones, right? So
it also affects bones and joints and connective tissue, and who had all the joints rebuilt, right?
Yeah, absolutely. So a lot of what you've described has gone through such medical reversals, and I want to tackle them. I want to talk about libido. I want to talk about mood and sleep and all of this. So, but ultimately, you received medical care that didn't address your needs, right? That's basically it. You went for expertise and insight, and you received none. So you were like, you guys felt it firsthand, the need for what it is you do.
Yeah, and then we started seeing it in our own respective clients, and that's where we were just like, enough, that something's got to change. And as Maria said, she keeps referencing she was given HRT and it didn't work, but only because what is HRT? Women are led to believe that it's this single thing. And there are so many iterations of HRT, forms, dosing regimens, etc. And so to just hand, I mean, hormones are wildly powerful. Why would you just hand a woman blindly hormones and say, here, have this and shut up? I mean, so now, and we're both full transparency, we're both wildly pro HRT and we're both on HRT ourselves now. But when a woman comes to us, whether it's sliding into our DMs on Instagram or sending us an email and says, can you tell me what I should do? It's not an easy button, you know, and the reason why we're so adamantly against just spitting out some simple answer is because we were given simple answers and they didn't work, right? We weren't given information.
Well, can I talk about this a little bit, because it's been a passion of mine. It's more than just estrogen and progesterone. Certainly, there's multiple different types of sort of estrogen and estrogen-like compounds. There's multiple different types of sex hormones. Often, the neglected sex hormone of testosterone in women, which can affect libido, and body composition. All of these things. If you look at the actual medical literature, they have come back. Right? Yeah. Meaning, like, there are now guidelines from the Menopause Society saying consider a, dose 1/10 that of men for women with hyposexuality. And they are now talking about, consider, HRT, particularly in early, menopause, basically. So I think, and which is a testament to, there's some signs of improvement. But I 100%
but they're kind of like dipping their toe without really wanting to commit. And I think that's the other thing, is these doctors didn't want to commit to our problems, right? They didn't want to do the work that it was going to take, not only to educate us, but to support us, give us resources, and this is what you guys do. I mean, the app and everything, from my personal friends who work with you and our clients, they said, between you guys and Tro, like, we had everything we needed to know. And that's what's missing, right? Is people look for easy buttons and doctors readily offer easy buttons.
Yeah, it's a big problem. We all want that magic pill here, give this. And the doctors are just doing a stamp here, take vitamin D, take this. And I'm surprised at how many people, women I've seen, that are seeing hormone specialists that never had a really good thyroid panel, just TSH, that's it. And you go, well, how do we know what's going on? And so that's really frustrating too for people.
Or they're told a TSH of 5 is normal, right? And that's the other thing, is women's like, nope, I've had my thyroid tested and it's normal. And we're like, could we see the labs? Of course, it's one lab. We get that lab. We're like, actually, that's not optimal and that's not normal, and it's, I don't know if it's a fault of curriculum and therefore training, or if it's a fault of commitment.
Can I tell you a quick little story? Because it's absolutely, the data is very clear. The lower the TSH, the better, right? Mm-hmm. Especially in hypothyroidism. So meaning, like, 2.0 in my practice is too high.
Oh, wow.
If I'm replacing somebody. I won't get into, Hashimoto's and all that. So 2.0 is too high if somebody needs replacement, right? Like, and I've decided to commit to that. And I'm shooting for somewhere around 0.2 to 0.5 as a goal for overall health, overall wellness, and weight loss maintenance even. But ultimately, it's how the person feels, right? Like, we've lost sight of that. How do you feel?
Right.
How do you feel? Like, how do you feel on this, right? Because hormones are great. I mean, I've had some women with some hypersexuality, and you start them at, like a 1/10 of a human, 1/10 of a male dose of testosterone, like, because we don't have any prescription grade testosterones that are, these are tiny doses, like enough to get the blood levels maybe to 40 or 50, not too much higher than that. And, and they feel great, right? They feel excellent with just a little bit of testosterone. But the flip side is this industry has been so predatory on women who have nowhere to turn to. I mean, I've seen the other end, which is, I have, patients that come to me with pellets and they have testosterones of 500.
Yeah.
We just got one with 1,500.
Oh my God. Mm-hmm. Just so people understand, 1,500 is a level that a male bodybuilder will aim for.
Yeah.
Right?
Yeah.
Will aim for. And that's, and I've seen it. I've seen masculinization of women. I've seen, they develop a deepened voice, and those are irreversible. I
Those
think-
are irreversible.
Oh, sorry. Yeah. So talk to us about sort of your approach and, how do you approach this population? Because I think that there's so much conflicting information, just like nutrition. How do you guys debunk what's out there, and how do you approach them? And I'd imagine to some degree you're like, even though I would say you guys are smarter than many clinicians I've met, oftentimes people look for that MD or DO or whatever it is, and PhD or whatever. And so how do you navigate being a health coach and sometimes knowing more than traditional medicine?
Yeah, we educate. We never try to lead people on. Like, we let people know we do not prescribe. We maintain, a really important list of physicians. Obviously, you're on that list for weight loss. And we just let people know. I mean, we do run into some people, non-clinicians and some doctors. I think a doctor who maybe was very acrimonious to you, Tro, who basically don't like the fact that we teach and have an opinion, and we're like, sorry, not sorry. We can read the research too. We have an opinion. We're not practicing medicine. We're educating. And then we are sending people to physicians. And then once we send you to the physician, your care is between you and the doctor. But we want the client to go in knowing what they want, because you know what happens when they don't? They get testosterone pellets and they get testosterone injections, and those are not good for women. And we're even beginning to wonder if they're good for men after some of the labs we've seen. So
the labs we see with like iron metabolism and whatnot on these men. But, I think that's where Maria and I, like I said, we're super curious learners, and we're heightened awareness that we aren't licensed medical providers. And we know there's a bogey on us for that. Someone can either dismiss us, discredit us, or whatever. So we spend a lot of time in the research. And if I showed you all our Google Drive of research that we have that is by subject matter and folders and whatnot, I mean, she and I, we sleep and breathe and eat this stuff all day long. And so we make sure that if we have something to say, we can provide some evidence for it and then say, take this to your doctor, or maybe you need a new doctor, right? And so we try to, we hate that phrase evidence-based, because let's be honest, scientific studies right now have gotten pretty corrupt as well. But, teaching a woman to say, okay, if you were 28 and your period went away, would anyone sound an alarm? Of course they would. This would be like a vital sign is missing, whether you want to have children or not. Oh my goodness, call everyone to task. We need to restore your menstrual cycle. Why is that? It's not simply due to fertility and reproduction, right? We know that if we remove the ovaries from women, or they, let's say, have chemotherapy and it destroys their ovaries or whatever, surgical menopause has incredible impacts on their bones, on their brain, on their heart health, on everything. So if you're a midlife woman and you've suddenly seen your lipids completely go to hell, your thyroid's wonky, you all of a sudden have belly fat that you've never had, and you have not changed your diet or your exercise whatsoever, maybe there's something to learn about the physiologic triggers that our sex hormones provided outside of fertility and reproduction. So we like to teach on that, and to appeal to women to say, you know your body better than anyone. Do not let it be gaslit, but understand what's happening behind the scenes. And then you're in a better position to go advocate for yourself. And so that's really kind of how we approach it. It's just, and if you don't agree with us, that's perfectly fine. But, most women start to go, oh yeah, this makes sense. Everything starts to kind of click when we teach them sex hormones actions outside of fertility.
Yeah, and I think it's such a frustrating thing. I have a patient I just spoke to last week, and she was seeing a practitioner that was helping with hormone replacement, and she also went low carb. And she went low carb for a long time. She had really hardly any benefit. She was laying in bed all day. She goes, I was like dying. I felt horrible. I went on HRT. It changed my life. Like, it's unbelievable. Mood, energy, focus, sleep, everything. And you think, wow, how many times are we missing the ball on that? Where people are saying, look, I'm doing everything right. I'm weighing myself 10 times a day. They're so stressed about this stuff. And they're like, I'm not getting results that other people are doing. And we can look at their continuous glucose monitor, see they're not eating cookies every night, but
Right.
they're just sitting there and not seeing a change.
Right.
Like what kind of things would you, when you see that happening, what kind of things are you focusing on?
We start with, are you eating enough?
Mm-hmm.
Then we look at, are you eating enough protein? Right. And then we look at, are there other things that could be driving this? Inflammation. Are you scrolling on your phone every night? Are you not sleeping? Are you, so we work on those basic lifestyle stuff. But in the vast majority of women at a certain age, when the hormones are low, it's impossible to get out of our own way, even with pulling all the levers, right? And that's where we say, okay, guess what? No one wants to talk about this, but estrogen actually impacts our mitochondrial function. Your energy is diminished when your estrogen is diminished. So let's explain that to them. And then all of a sudden they're like, why is no one telling me this, right? And we usually end up with pretty fiery, excuse my French, pissed off women as clients who are like, why is it not medical malpractice that any provider giving care to a woman is not talking about this? And we're like, that's a great question. Because if you got a client 40 and up, you better be looking at that picture, and the vast majority of them aren't.
So can you guys talk to us about each of some of the sex hormones, estrogen, progesterone, and testosterone, and what should a like a newly postmenopausal woman versus a sort of postmenopausal woman in their 65, 70, what do they need? How do we go about this? Educate us.
I'll start with estrogen. Estrogen, the loss of it is really pretty much responsible for most of the symptoms. But here's the thing, and I think this will be valuable for the audience, and that is, we hear like the term estrogen dominance a lot. And I think it's a really, really misleading term. First of all, we are estrogen dominant, as that's a really primary female hormone, is the the hormone that makes women women. Estrogen does surge in perimenopause, kind of goes up and down. It gets a little wobbly. It's in decline, but it's also a little bit wobbly. And so when estrogen kind of is higher than progesterone, we're considered estrogen dominant. Again, typically not a phrase that Kristin and I like to focus on, because it gets women thinking like, I need to detox my estrogen. I need to flush my estrogen. No, you really don't. You kind of like, perimenopause is a little rough. It can be a little bit rocky. Sometimes the only way out is through. But estrogen is, it is changing. It's leaving. We have three main estrogens: estrone, estradiol, estriol. We have estrogen receptors that these estrogens signal at. And it's really an amazing hormone. It just makes us more glucose sensitive. Again, when it's gone, that's one of the things that Kristin and I say, you gotta be careful with carbohydrates because of estrogen loss. And we also let women know that when they replace their hormones and they put estrogen back, it's not the same. It is somewhat concocted, right? We are postmenopausal women. We are taking hormones. You still have to watch the carbohydrate intake. So it's not a whole pass for that. We still have to eat healthy. So that's estrogen. Kristin, you can take over with progesterone.
Yeah. Well, even to get there, I would say the focus, as you just said, was, early postmenopausal versus maybe later 60, 65, et cetera. Maria and I would say, let's back it up even further, because a lot of the shift of these hormones is, progesterone starts its decline first. It's dramatic. I think it's a 75% reduction in our progesterone between age 35 and 50, whereas it's a 35% drop in estrogen between those same ages. So that's where you get that kind of like divergence in their ratio that causes this estrogen dominance idea. But what happens is that women, there are changes happening in the background that women in perimenopause aren't aware of. And let's be honest, most of us are motivated by changes we see and feel, right? And so when the scale starts to go, all of a sudden we call out the guard. But the problem is before that scale actually started to go, your vascular structures started to lose tone. Your bone remodeling started to slow down. Your muscle tissues were changing from fast twitch to slow twitch, right? Your muscle mass is in decline, which is why your insulin sink is lower and therefore your glucose tolerance is changing. Your microbiome is shifting with the loss of these hormones. And so suddenly you find yourself almost, in like an IBS type situation or Crohn's or whatnot, and women are wondering what's happening. So our position is it's actually better if women were to start in perimenopause when the symptoms appear. So whether it's, to be honest, I know you're guys, but you both married women, dry vaginas, right? Loss of libido, feeling that crepey skin, having the weight shift, etc. That is when hormonal replacement actually should be initiated. Because if the HPO axis between the brain and the ovaries is starting to sputter, the only way to get it to connect back up is to restart it, right? Is to restore it. So we're fans of starting in perimenopause, to be perfectly honest, because you've got the best chance of maintaining, especially your cardiovascular health, if you don't wait until that final menstrual cycle of menopause. And so then, the early menopausal women, it's not like the ship's left the harbor and you're kind of out to sea adrift right now. It's okay. You need to be even more intentional about your nutrition and your lifestyle and whatnot. And you're probably going to need what we refer to as physiologic levels of hormones. You want to get those hormones up to almost their premenopausal state. The women in their 65, 70, et cetera, who are further away from menopause, there's nothing wrong with replacing hormones, but understanding that you've had probably 20 years of cardiometabolic changes at play in the background means that you need a little bit more oversight, right? And this is why we would say, go get your LPA, go look at a CAC score, look at your inflammatory markers. I mean, I remember, Tro, in our conversation, one of the blood chemistry markers that we had tested in a client that we sent to you was LPPLA2, because she wasn't showing signs of inflammation in other ways, but her lipids were deranged enough that we had concern that maybe she had arterial inflammation, and that's not going to show up on an HSCRP. So, we say to women, it's just, you're not a candidate. It's just, you need more oversight. And looking at those things more deeply takes commitment. And as we kind of keep coming back to, unfortunately, most doctors in this space, other than the two of you and some other really gems out there, aren't willing to make that commitment. And, I could go to my local hospital and get a CAC score for $75. So this isn't as though what we're asking for is really high bar, financially prohibitive type stuff. This is just basic. Understand what changes have been going on for the last 25 years in these women at 65, and then make sure that there's some sort of stability there. What we see too often is a 65-year-old comes to us and is told, I'm osteopenic or I'm slightly osteoporotic, and they put me on calcium. Oh my God. Nobody should be putting a 65-year-old woman who's hormonally deficient on calcium, because calcium needs estrogen to signal it. And guess what? It's going to happen. Estrogen's just going to go and lay down in those arteries. So it's those sorts of things where Maria and I try and teach women, here's where you're at in your phase of life, what needs to happen. Here's where you're at. Here's where you're at. And it is, individual based, but it's giving them first that understanding that, like, did you know that estrogen maintains your fast twitch muscles? Did you know that progesterone maintains your neurotransmitters? And they learn that, they buy off on all of the lifestyle and foundational changes so much more easily. So it's really just for us is giving them that kind of, hormones over the life cycle sort of understanding.
Yeah, and I think that's a question we have as practitioners. Let's say we have a perimenopausal female who just gained 30 pounds in the last 3 years or 4 years, whatever. Starting out doing low carb and all these kind of things, checking thyroid function, all that. I mean, should we be checking hormones at an earlier, like right up front, more so than putting it off and saying, let's see how you respond. And if you don't respond, then we'll look at hormones.
Yeah, I mean, we would say here's the two things. One, we've got a North American Menopause Society saying you don't have to test at all. And Maria and I call complete BS on that. The reason being, women normalize their symptoms. If we're going to gauge whether or not a woman needs hormones just based on how do you feel, how are your symptoms, vast majority of women, other than the physical aesthetic changes, which they complain about, they're not going to come and tell you that they're not sleeping and they're not having sex and they're not, that they're yelling at their kids and all of those things. So, we say, yes, you have to test because they're often unaware. And symptoms, Maria likes to call it the halo effect. The adrenals can give enough hormones sometimes as the ovaries shut down to mitigate or delay symptoms. That doesn't mean those changes aren't happening at the bone and the heart and the brain and everything else. So that's why we say, yeah, you've got to be testing. Now, Maria, do you want to say what's going to be the antidote to that? Someone's going to come out and say, you can't test in perimenopause.
Well, right. I mean, I think actually the test to really follow in, say, like the 30s is FSH, really. Even more than estradiol is you just want to see sort of like the brain's happiness with the estradiol level. And obviously that does jump around, but if we start to see that rising, we get a little concerned that she's going through the perimenopausal, the menopausal transition.
Yeah. If you see an FSH over 25 more than twice, it's time to bring in the hormones, period.
I want to ask. Sorry, go ahead.
Oh, I'm just going to throw one more intro. Sorry. The other thing I've noticed, I've had some postmenopausal women. They come in, we do low carb, they start losing weight. Then all of a sudden their hot flashes come back. They go, I didn't have this for 15 years. Now I've lost weight, and we're seeing that.
Yeah. So fat's an estrogen source. And yeah, I'm assuming if they're losing body fat, which is really overall a positive thing, right? Then they're going to possibly lose a little bit of that estrogen source. Yeah.
And then we're seeing the opposite in guys too. When they start losing weight, their testosterone will start going up, right?
Yeah,
Instead of starting right away with replacement, go, hey, we lose 50 or 60 pounds, all of a sudden the testosterone is bouncing way up to the normal range again because they're losing that estrogen effect.
Exactly. Yeah.
So what's your take? So I think I've seen both ends of the spectrum. I think modern medicine is, has not really thought about the physiologic needs of sort of tiny amounts of testosterone, if it's needed, if it's beneficial. And I think women have been preyed upon by, pellet gurus who've, superdosed testosterone. The ovaries do make testosterone. What's the take here on testosterone? I became favorable to sort of microdosing, like transdermal testosterone, and not a lot of patients, but always monitoring, make sure it never goes above 40 or 50, sort of, but just enough that. And I've had people, say like my libido's back, So what are your guys' thoughts with sort of small, tiny doses of testosterone?
So we are definitely fans of testosterone. We are anti-pellet and we are anti-injection for testosterone for women, for certain. We do want women to get their estradiol and progesterone kind of, I don't want to say balanced, replenished, replaced first. And then 6 months, maybe 9 months later, transdermal testosterone, small amounts, are perfectly fine. And Kristin, if you want to kind of get into the whole receptor thing, because I don't remember it word for word.
So estrogen and testosterone share a receptor wall. And what some of the studies have shown is that testosterone, when given at the same time as estradiol, before estradiol is fully replenished, can occupy part of that receptor wall, which can block up to 1/3 of the estrogen uptake at the receptor. So that's why we say get your estrogen where it needs to be before adding in testosterone. And, that sometimes can be a hard spin for women because they've been so messaged to that testosterone's this end all be all for mood and libido and all of these things. And while it can be, estrogen's doing the really important stuff behind the scenes in terms of lipid management and, all the bone remodeling and the muscle tissue and everything else. So our position is focus on estrogen and progesterone. That's what, women rely on most for our cardiometabolic health, and then add in the testosterone. On the libido front, though, I think one of the things Maria and I message on that women don't love to hear sometimes is that testosterone can make you willing, but it's actually estrogen that makes a woman desire it. So, there's a difference between you approaching your wife and getting a little frisky and she'll be going, yeah, okay, fine, versus her coming to you at dinner and being like, hey, tonight. And so you're muted.
What's that drug? Just so I just.
I think our husbands is unequal too, but no, it is. Estrogen is going to be bigger driver. But the other thing that we like to say is libido is so multifactorial. And, Maria and I have been married 30 and 35 years respectively. And, there's a lot that comes into libido in the bedroom that goes back through those 30 and 35 years. And I think people think that if they get testosterone, they're suddenly just going to be this like sexual powerhouse. And that's unfortunately not the case, So we will sometimes refer clients to listen to some couples therapy podcasts that discuss communicating about, sex and libido and things like that, because frequently we've all kind of gone into this sort of, I don't know, like a muted discussion on things that should be discussed between partners. So hormones are great, but there's a lot more at play.
Yeah, and that's such a huge deal. What's the relationship like? What's the stress levels? And like when Maria, when you were telling your story about being on Klonopin, is like so many doctors never say, okay, you're not sleeping well. Let's like, why? Is it hormonal? Is it you're fighting with your husband every day? You're stressed out at work? Yeah. Like what's going on? And how much is that going to affect your hormones? Sleep is it, I was just reading a study about how the deep sleep, how it makes you more insulin sensitive. So if you're not getting deep sleep, you get more insulin resistant. And, all these things that we like, I have so many patients that no one's ever talked to them about what they do for fun, this whole oxytocin thing comes up too, right? Like the sad part about it is because of pharma, I read like 60 studies on the importance of oxytocin, right? Of just relaxing and having fun and taking it easy, not being stress intense and worry about every pound. And, at the end of all these studies, they say, if we could only manufacture a long acting oxytocin to inject into people, and it's like, how about telling them to go to the beach or go outside or go throw the ball for their dog for an hour or something like that, right? They like, we can't just enjoy life and enjoy our partner and relationships.
Right. I mean, come on, we can all admit that when we're on vacation with our partner, things are a lot more fun than when we're at home, right? Take oxytocin to cause that, or exogenous oxytocin. So
I think so much of medicine and coaching is about, like, what do you find joy in? What do you find happiness in? What do you find fulfillment in? Can we get rid of the stress? Like, how are you going to, a lot of what people turn to manage this sort of stress and fulfillment mismatch is things that are not desirable. Drugs, food, alcohol, shopaholics, gambleaholics, whatever it is, right? So a lot of this is just this mismatch between what's stressing them and the chronic stresses in their lives. And some of those you can't get rid of. You can't get rid of the fact that, you may need a job, you may need, but you may not need that job. You may have childhood trauma. You're not going to erase your childhood trauma, but you could bring in things into your life that sort of promote enjoyment. And I find a lot of what we do is just comes down to this, like, how do we decrease sort of the negativity and sort of increase the positivity in somebody's life? And there's no formula for this, right? It's not taught, right? This isn't a concept that medicine has taught me, right? It's just called being a decent, reasonable human. And the problem with modern medicine and modern coaching, I'm sure you guys have encountered coaches who are so sort of, I don't know what they're doing, or the trainers or whoever they are. I mean, you could pick a teacher, a pastor, a principal, it doesn't matter, right? It's what happened, can they actually help that person in front of them figure out what it is that they're facing and get to that next level? And that's missing. And that's missing in so much of such as medicine. I mean, you guys described your doctors, which are terrible. I mean, we see it in coaches, we see it in, trainers, we see it in nutrition. Ultimately, what is it, right? What is it that's bothering you, and how can we help? Just those comments, just that outlook. It's remarkable that's novel nowadays, or interesting, or rare. I mean, what does that tell you about our society?
Well, one of the things Maria and I like to pull out is when we have a really entrenched client who is convinced that there must be something in the test to explain why she's having these issues. Maria and I will say, sometimes we do what works for ourselves, right?
Oh, she cut in and out. Do you guys hear her?
No.
No.
Sorry. Yeah. Okay, sorry. I was trying to decline a call on my phone here. I thought I was done. But no, what I was saying is that there's kind of this Dr. Phil quote that goes around about, everyone does what works for them. And so when someone really can't get out of their own way, Maria and I will dead on to their face say, it seems as though this is working for you. Like you want to do these things. Sorry. That you want to do these things. And so we need you to kind of step back and say, what is actually important, right? What is it? Is it that relationship with your husband, or is it more owning this? I'm the CFO of a company and I'm a woman and I fought for this hard, and we're going to ignore that I'm not sleeping and I'm fighting with my husband and all these things because I have this, kind of, image in the public eye or whatnot. And Maria and I mean, we've had, Maria, how would we say 60% of our client calls end up with crying, right? Mm-hmm. Because we push back hard and we're like, look, we get it. We've both been there. We've both had careers. We've raised 7 boys between us. We've got 65 years of marriage. Like, there isn't a lot that we haven't unfortunately witnessed either for ourselves or our loved ones. And so when we hear these people really complaining and giving a lot of excuses, we do not hesitate in saying, I think, it's time to kind of step back. We've recommended CBT. We've recommended non-sleep deep rest protocols like that Huberman likes to talk about. I don't care if it's get outside, stop exercising, get outside and walk in the grass with your puppy at 5 a.m, like basic things. And when people don't want to do that, that's unfortunately as coaches where we have to say, okay, then clearly what you're doing is more important for you.
Well, you need that buy-in, right? So people need to know, like, listen, this is a process, one, and two, you deserve health. I think most people who are at that point, they've been so focused on their career or whatever it is, status, money, family, and they've achieved those things, and that's great, and that's amazing, right? But what did you sacrifice, right? Yeah. And what did you sacrifice, and are you willing to keep sacrificing it? And how do you want to reconcile it? And so I think, it's, are you ready for change? Readiness to change assessment is so hard. And then also like those questions, like what is giving you happiness here at this point? You were a hotshot corporate attorney, and now it's like, well, what is giving, like, where am I? Where am I really?
Right.
I found myself at 350 pounds and burnt out, and I'm like, why? It's in my second year out of, residency. Why am I burned out?
Right.
Yeah, along these lines, this is really interesting to me, and it really started getting me looking at this. I have a guy, he's 73 years old now. I've been taking care of him since he was 53, 20 years. I know I'm not old enough to have a patient for 20 years, but I do. Anyways, this guy has been 183 pounds for 19 of 20 years. This year, he's 203. He's gained 20 pounds, basically, 23 pounds since 10 months ago or 11 months ago. Like, what happened? He's a free spirit guy. He's a pilot. He flies his own plane wherever he wants to go. But now his mom's 99 and has dementia. So he's staying at mom's house now, helping her, waking up 3 or 4 times a night, checking on her. He said, look, my eating hasn't changed. My drinking hasn't changed. My exercise hasn't changed, but my sleep and my stress level have changed. That's it. So you're going to tell me that doesn't have, like, at 73 years of age, you start gaining 20 pounds in a year?
Right. Can I tell you, we've quantified it. In fact, sleep deprivation by 1 to 2 hours a day. So if you reduce your sleep by 2 hours per day, you're going to increase your caloric intake. Not that I care about caloric intake, but it just tells you about the hunger that's driving it, whether it's through insulin resistance or stress or whatever it is, by 300 calories a day, just by sleeping 1.5 or 2 hours.
Yeah, I mean, it's not going to be 300 calories of steak either.
Yeah. No,
it's going to be 300 calories of salty popcorn.
Much harder.
And then you're going to have struggles with your relationship and all these other things. Like, Tro and I have said it from day one, and it's still just as true today for the last, what have we done, 4 years ago, 5 years ago?
5 years ago. It's going to be 5 years. 5 years ago, you reached out to me. It's 5 years ago.
And so, anyways, 5 years ago, we started saying, look, the biggest determiner of whether someone has success or not is stress level and family support. And that has not changed 1 second. I mean, it's so true, is that, some people have people in their life that are going to, when they're eating healthy, say, here, have pizza. They're going to bring them cookies and donuts, and they really destroy their success, but also stress. Because when people are stressed, they say, oh, I can't plan my meals. I don't have time to exercise. I can't sleep. If then they want to work out. And the great point you raised earlier, I think it was Kristin raised, is that you're trying to out exercise this. And so you're stressed out, you're trying to exercise more, your cortisol is going through the roof. And so it's such a battle to say, okay, instead of exercising 10 days a week. Maybe I just take a day off and relax and go for a walk on the beach or play with my dog, those kind of things that we have to kind of figure out. But yeah, that's the big one I've seen is people who are very career oriented. They really get into a problem, and that's their identity too. Like being an attorney, when you're not an attorney or you're not practicing an attorney, like it's a weird thing. Like I went through all this schooling and now I'm just like doing something different,
Yeah.
So it's really intriguing. And there's a lot of people who are just, they'll sacrifice all their whole health and then they get sick and they would spend all the money that they made on trying to get healthy again. It's insane.
Yeah. And I think, for our demographic of clients, the other piece is that this is a time of life where women naturally self-isolate. And you add in, unfortunately, the last few years, wherever anyone fell on that spectrum, doesn't matter, politically, personally, whatever the opinions are, we all ended up losing some community through that, right? And so you've got this really wicked combination of the last few years, and we're seeing it play out in these women. They're more agitated. They have convinced themselves that it's something being done to them, etc. And when Maria and I just try and basically explain, like, what, maybe we look at, and we do look at everything. What is your average day like? When you wake up in the morning, you're looking at your phone, do you take your dog for a walk? Do you go outside ever? What's going on? And when we start to peel back kind of the daily habits of these women, and who do you have to talk to? And they could have the best relationship with their spouse in the world, but if that dialogue is not there and it's just internal, it's really counterproductive. And so we've just really been trying to work on like even promoting community within our own lives and showing it on Instagram to be like, look, Maria just spent 2.5 weeks in Europe. She did an Instagram from there every day, right? And because she was present with her husband. And we had that talk with each other. I'm leaving for Norway for 2.5 weeks. And I said, look, I'm not going to be, I'll send you pictures, but let's not post anything until I get back, right? Because we've lost that ability to be present. And when we lose that ability to be present, we lose the ability to hear ourselves and those around us. And that piece of it, honestly, it used to be like, okay, let's resolve sleep. We're like, no, let's go back even further and figure out your interpersonal relationships, community, and support. Start there. Then we can start working on these other things.
Yeah.
Yeah, it's amazing.
And then Tro, as social media, I've been in Arizona the last week, so I haven't looked at social media barely. This morning I woke up and I go, I'll just see what's there. First thing I see is Layton Norton picking on Tro, and I was like, this is hilarious. Like, what have I missed for the last week? Where have I been? But just being in the moment and not really like, my office manager just got back she was way out in Switzerland and traveling around, and she said no one had their phones at dinner. No one had their phones out. And she said we were on these epic hikes and no one was taking pictures. They were just enjoying the moment. They were just enjoying it, not being like, oh, let me get this on Instagram. Let me get this shot. Let me get the light right. They're just like enjoying the moment. It's a difference, right?
Yeah.
Except for Tro at the gym, doing selfies at the gym and stuff.
Maria will get mad at me because she'll be like, you're going out to this farm tonight with friends. Send me a picture. And then I'll call her in the morning and be like, I forgot to do it.
I forgot to do it.
Out of my purse.
Yeah.
So,
by the way, your picture behind you, I was like, where is that? That's beautiful.
Oh, that's at Arch National Park. Yeah.
Oh gosh. Yeah. You see that and you go, that's going to be better medicine than,
Oh my gosh. Nature is medicine.
Yeah,
100%.
absolutely.
Yeah.
And there's studies on that too. I mean, that's what's so great is these things we inherently know. They have to do a study to tell us what we inherently know is like, okay, if you go out and, as a matter of fact, just yesterday I had a patient, severe depression. We're trying to get her depression better. I said, when's the last time you laughed? And she said, you know what? 4 days ago, I was out in the park with my husband and my dog, and we just threw the ball and she was running back and forth doing crazy stuff. She said, we were just cracking up. And then you come back and you're depressed again. So it's like, okay, go throw the ball more for your dog, whatever you enjoy, like figure that out.
Yeah. Yeah. I used to have a law professor who people would get so stressed out, they'd make themselves sick before exams. And this professor was adamant that we do one of two things. We either watch a comedy or a horror movie the night before an exam, because he was like, it helps you completely detach from this stress and these realities, and you can go in and do this. And so my husband joked, like when I was studying for the bar exam, I mean, all I was doing was watching comedies every night because it was the only way to kind of keep me in this like non-sympathetic dominant phase of life. So yeah.
Whatever works.
I think also having that, well, you guys hit the nail on the head, Brian. You mentioned this patient with depression. You guys are talking about, just those interpersonal skills. that community is so important. And whether it's, CrossFit, a church, family support, one of the things we do in our clinic is we screen for domestic abuse, childhood adversity, who are the partners in the home, what's the, who's your support system, what's your support system, who's ordering the food around you, these are the sort of the basics it tells you. And if you look at obesity and just in general, you can see it spreads in social networks, meaning that the people around you, what they're eating is what governs what you eat. And it's definitely a contagious phenomenon, in my opinion. So it's so important. Sometimes, just today I had a patient who's really starting to make some headway and face some challenges. And I said, well, who's in the home with you? She has 3 kids. She has a husband. I'm like, do they know, your A1C is 10 and, that you don't have a choice, and that, she broke down. She said, well, it's hard for me to be vulnerable to my family. So, us as clinicians, we have to break through these barriers in order to, if we have to own, I have to commit to that patient. And I said, well, look, here's a suggestion. And I hope I'm not overstepping, bring everybody in your family to the next meeting so that we can get support for you. And the problem is there's no place for this in standard medicine or standard coaching. Right. And the reality is this is what's needed. Right. Yeah. And the only way you can take those steps, which I think we're all talking about here, is owning the patient, owning the client. Right. You have to, what is it that they need? And whether it's tough love or that sort of empathetic love.
Hey, you blew it last week. Big deal. Let's start this week off. Whatever. You can't just live in the past and be stressed out. And there's so much to this.
There's no AI for that. You can't AI this, right?
You can't AI marital problems and work stress and not sleeping and kids being a jerk, whatever.
Check the box. Sexual dysfunction. Well, you need 1 minute, 5 minutes in nature and 3 milligrams of estradiol. It doesn't work like that.
Right. Yeah. We always, women have a tough time doing for themselves. I think that's a hurdle that Maria and I unfortunately face regularly, especially as moms and especially at this age, because you're often in the sandwich generation. We've got elderly parents we're dealing with. We've got kids. I mean, Maria and I, luckily our kids are all out of the nest, but whether they're in the nest or out of the nest, you're always mom, right? So you're always dealing.
Shoot. But I would say I'll jump in while you're muted here for a second. But yeah, I think it's that nurturing, the people who nurture everyone around them, but they don't take care of themselves. They're making sure everyone else's needs are met except theirs. And then, then it's too late. They're trying to fix everything again, especially if you have a sick spouse or someone that you're really taking care of, a parent or family member, a child. I think. Kristin, sorry, you got disconnected.
I don't know what's happening here. I'm plugged in, but no, what I was saying is that we often tell women your kids are watching. So what behavior are you modeling to the people who are important to you, right? And that's the biggest thing for women to be like, oh, they don't want their son or daughter to see the chaos, the deprivation. I'll just have a coffee for breakfast and I'm out the door and I'm going to over-exercise. I'm going to do this. So even when they can't consider doing it for themselves, we can get them to flip the script and consider doing it just to model better behavior.
Yeah. Yeah, I mean, that empathetic person, 100%, Brian, you were talking about it. They take care, they put other people first. And the most important thing is who's going to take care of them if you're dead. And I don't mean to be dramatic, but, in some of the cases we see, there's a 20 or 30 or 40% 10-year risk. I mean, you have a 40% chance of dying in the next 10 years. I mean, who can we start to think about? It's not that you have to be selfish. It's altruistic to take care of yourself.
And Tro, this is based on what their A1C or their cardiometabolic marker?
Yeah, all of it. We can prognosticate, see imaging. We take lab tests, imaging tests, vital signs, age, etc. Put it all in, and we can prognosticate their 10-year just cardiovascular risk, not including cancer or whatever else.
And I would imagine, kind of knowing that is very helpful to get people on board.
Yeah, I mean, well, yes and no. It could be scary also. I mean,
sure. Yeah.
I think, one of the biggest tools in that is what you guys already promote, which is calcium scores and, vascular imaging, doing a carotid intimate media thickness, looking at the carotids for soft plaques, looking at the femoral area for soft plaques. that drives much of the risk. But then, things that about metabolic syndrome and blood pressure, right? If you have metabolic syndrome, blood pressure, diabetes, and you have plaque, we're talking about a 30% chance of dying in the next 10 years.
Wow.
So that's, I think that it's not to use fear as a motivator. It's more to say, like, it's not you being selfish and weak. This is you doing what needs to be done to take care of your family,
Right.
and, but yeah, you're absolutely right. When you put it in that perspective, like, it's not being selfish, it's being altruistic. It's truly being altruistic. I think people, that's the way I've been able to reach that sort of crowd.
Yeah, that's even where like an LPIR score can wake people up big time, right? They're like, oh, my doctor says my cholesterol is great, all this stuff's great, blah, 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 blah. And we show them an LPIR score of like 58. And they're like, and we're like, look, you're headed to diabetes here. So it doesn't matter that you're not excess weight. You love your body composition, you're sleeping, you have all these good things going on. Your labs say otherwise, and we do not hesitate in pulling out the fear lever sometimes.
Yeah. I mean, the goal is not to like make people upset, but this is the reality, I mean, but fear is a motivator, but, and I think really what's the motivator for these people, it's not that we want to make you afraid. Like, this is what you're going to be facing. And so
this is all fixable. This is all fixable stuff, but we can work on that. Not wait 10 years.
That's the best part of the news. Like, when we're like delivering like not so optimal results, and we let people know right away, like we can handle this. Like you can do something about this. You can change this. So yeah, that's important, is to giving people hope.
We can't let you both escape without talking about Dutch testing. When do you pull that lever?
When do we pull it? Well, as part of our program, we use it for all women. We don't like Dutch tests for volume, right? That we like regular blood serum testing. It's just the gold standard. Dutch, we like to see, how's the estrogen kind of metabolizing in the body. And then they've added a lot of value over the years. Every so often, and this is so significant, we get a woman who's like wildly B6 deficient. And by the way, many of them, when they're B6 deficient, they are like struggling with mood. Okay, so that's a huge thing. We see B12 deficiency, and then we get to kind of marry that with, you have H. pylori, so your stomach acid is probably low, and then sometimes we can see a thyroid signal on the Dutch test. It's not a definitive thyroid test by any means, but we see a specific kind of adrenal presentation that says, you need to go get a full thyroid checkup. What else, Kristin? We like the quinolinate marker. It looks like kind of brain inflammation. So, I mean, they've really kind of worked on adding a lot of value to it.
Yeah, and the diurnal pattern on the adrenals, or just looking at metabolized and freeze relationship, all the thyroid RX or HRT or anything else isn't going to do much if her adrenals are completely shot. And we're not believers in the adrenal fatigue. We're believers in adrenal dysfunction, right? Mm-hmm. And does not matter how much they tell you, like, they got life going good. When we see those adrenals out of whack on the Dutch, we're like, and now we have to have a talk. Something isn't going good.
And then it's coming back to stress management, or are you doing some replacement? How are you?
Stress. I mean, sometimes we see evidence of, the adrenals seem to be very, very prone to, cortisone type drugs, injections, nasal inhalers, things like that. So yeah, but if it's not that, then it's a lifestyle issue.
Yeah, we'll see people on SSRIs and they can't understand why they can't get out of bed in the morning. And then we're like, oh, well, let's look at our free cortisol. So there's those sorts of things. But then also, you'll find out, well, yes, my mom was just diagnosed with dementia, but, something they just kind of left out, right? And so we'll talk about, the lifestyle strategies that could help, but maybe you need some adaptogen support, right? So L-theanine and, ashwagandha, if it's fine for you. Mm-hmm. So we try and help them be like, look, we're going to line your toolbox with tools, and it's up to you to sort of, mitigate the darts that you're getting thrown at yourself from life with some of these tools, while also committing to the lifestyle changes, right? You don't get to stay up and scroll on your phone until midnight because you can't sleep because you're worried about your husband's job or something. You still have to do the work, but by the way, here's some tools that can kind of help you maybe be motivated to do that work, maybe feel like you can take the edge off. And so they're more capable of doing those things. Yeah. So that's part of what we love the Dutch for. And then we also do gut testing. We test everyone's gut with the GI map. There's some controversy over which, stool test is best. We don't dive big into the whole SIBO and all of that kind of stuff. But if you see someone who's got a wildly dysbiotic gut, there's some really low-hanging fruit there for you to work on in terms of nutrition, lifestyle, and stress. So that sort of stuff we just try and use, again, because as you both said, data, it can be motivating. Data can be more motivating than losing pounds on the scale or being told you need to be around 10 years from now. If they have that data, all of a sudden they're like, they can't continue with the cognitive dissonance that what they're doing is not a problem, right? And so that's partly why we use that testing. But we don't give it to ladies right away. We make them wait a month because our attitude is you got to put some skin in the game. You got to start working on the nutrition. You got to start working on the lifestyle. Then we'll talk to you about tests. So
I'm a big believer in data and showing people data. It's empowering, right? It's your body, it's information. I cannot echo that enough. Data, more data. And having your eye on the prize. Guys, thank you so much for coming. Brian,
it's a pleasure.
This has been fun. We got to do this again. People are going to hear this. They're going to have questions about hormones. They're going to have questions about the Dutch test. And how do they contact you? How do they get a hold of you?
Well, they can go to our website. So that's wiseandwell.me. Or they can just follow us on Instagram. We're Wise and Well on Instagram. They just type that in the search bar. Kristin and I picture will come up in the little circle, and they'll know that they're on the right account.
And we've got some links in our bio. So if people, want some really low kind of cheap cost options, then diving into big, deep work with us, we've got a whole class on peri-menopause, which honestly, whether you're 35 or 65, it's all the same, really understanding that whole hormone play. We've got a great thing on protein and muscle because, women today, they're starting to adopt strength training, but at the end of the day, they still think, well, I don't want to look like a fool in the gym, or I don't want to get bulky. And, we want to explain to them, like, this is really an important kind of organ for you to optimize and chase. And you're not going to get bulky because most of us don't have enough hormones to get bulky at this age. But so we have those things, but we also have a really free community. We don't have a wonderful app like you guys do, but we have something run on Mighty Networks, which is an alternative platform. There's no ads, there's no friends, there's none of that kind of crazy noise. And it's just a closed kind of channel where Maria and I try and go and post more long form content than what social media really allows us to do. So we find women engaging in there, and whether they work with us or not, they're more than welcome to be there. So that's just some way of creating community that we've attempted.
Yeah, and they have to access through our Instagram bio. So.
Yeah.
All right, and can you consult across the U.S.?
Yeah, we have.
All right, awesome.
We have clients around the world. We're right now, Maria, we've got someone in Colombia and Israel and
Dubai, Italy. We've done, yeah. South
Awesome
Africa was
stuff.
a bit of a stretch. It was so far, but yeah, we've done that.
Yeah, that's a hard
Yes,
thing with
it
the
is.
timing and everything. Yeah, that can be a challenge. So good. Well, we'll keep you busy. I think I have a few people I'd like to throw your way and help out.
And do you guys are you just serving the US, right? Not international?
Our app is nation worldwide. So any country, 130 countries, I think we're in. We're only in the English language. We can offer health coaches basically worldwide. We have one health coach with worldwide insurance, but otherwise medical care is
US.
Medical care is US.
Yeah,
Got it.
that's what I thought. Yeah.
We want to say thank you to you because when we refer clients to you to be patients of yours, we make the point to them that the commitment you've made to go get 50 state coverage is not a small feat. And it goes to show kind of how committed you guys are. So we appreciate it beyond anything that we can express. There aren't enough doctors like you guys out there doing the hard work. And so we thank you for being available, because we do refer people to you quite a bit. So
Yes.
Yeah, thanks. And we all have to work together. That's the point, is having, people who understand, because we're not experts in hormones. I'm not, at least. Tro probably is, but
No.
say, hey, get the
No,
best
but-
person in that part of it. You're having mood stuff, have the best person here, have the best person of coaching. That, all this, if we work together, then we can, because we can't do it all on ourselves, by ourselves. So it's like, we all need each other. And so, having people like you who understand it, and we say, look, we got to get this part of the equation fixed. I'm not the person. It's really great. It's really great that when we have people of expertise like yourselves that we can rely on to help patients. And ultimately, we all care about getting the patient better.
yeah, thank you.
Yeah. Thanks for having us.
Yeah, we've loved it.